Have you been to this medical practice before, Lisa?
I have, yes. Probably about 3 months ago.
Okay, that's good. It means that you're in our system. So, what brings you in today?
I think I may have a bladder infection. I've got a sort of feeling in my lower belly, a sort of cramping. It's like there's a heavy pressure near my bladder. It's hard to describe. I also have some pain around here in my lower back.
Right.
It's kind of like period pain, but I finished my last period about 2 weeks ago, so I don't think it's related to that. That was on the 16th. The main thing is it feels like I have to pee every few minutes. I always seem to have the feeling that I need to go. There's also a bit of a burning sensation when I do go, so that kind of makes me not want to put it off, if you know what I mean.
Yes.
The pain isn't too severe, but it's enough to make it uncomfortable. The pee seems to be a bit cloudy too, and, well, it's a little embarrassing, but it has quite a strong smell.
What you're describing certainly fits with an infection. It's a common condition, and it's treatable with antibiotics. What's your understanding of what may have caused it?
I was reading online about it, actually, and I know you can get it through lots of ways. But I'm not in a relationship right now, so I know it's not from anything sexual. I don't get to go to the toilet very often at work, and I read how holding it in can actually bring on an infection.
It's possible, yes. May I ask, what kind of work you do?
I work in a factory. The work's easy, nothing strenuous, and my co-workers are great. And our boss actually lets us go to the toilet whenever we want to. The problem's more that I have to put on a protective suit as soon as I get in and keep it on all day. It's kind of inconvenient when you need to go to the toilet. It means unsuiting, then going, then resuiting. It's a lot of effort, so you tend not to bother.
Right.
Actually, we've got a routine. We hardly drink anything before lunch and then nothing at all at lunch. If you don't drink, you don't have to go to the toilet. It's simple, and it works for us. I always have a beer after work, in the evening, so I keep my fluid intake up generally.
Well, dehydration and also holding it in for long stretches can certainly be a factor. How many times would you normally urinate throughout the day?
Usually, I don't know, maybe 2 or 3, sometimes not at all. After work, it's usually once, so I'd say 3 times altogether. But since the symptoms started, I'm having to go at least 10 times a day, and sometimes more. And it's just such a small amount, but I still have what I can only call a strong urge to go. It's annoying to have to go through all the undressing and dressing, just for that, and so often.
Are you taking any medication at the moment?
Not really any medication for health reasons, but, I'm on the contraceptive pill. I've never had any problems with it, though, and I've been on that for about, it must be 2.5 years now. I also take Panadol if it gets too painful. Do you think it's possible to get the antibiotics for this today, Doctor? It's really driving me crazy.
All right, the first thing we need to do is take your urine sample. This will give us a good indication of what we're dealing with. You'll need to get a midstream sample to be accurate.
So, Sandra, you've been referred to me by your GP for a possible colonoscopy, is that right?
Yes, that's right.
So, can you tell me what made you see your GP? Had you had some type of tummy upset?
Actually, I was feeling really tired and run down at the time and just wanted a checkup. He suspected a possible virus and recommended I have a fasting blood test, which I did. And when he was explaining the results a few days later and taking a more detailed history, that's when he said I should come and see you.
So, did the test results show something out of the ordinary?
Well, just that my iron levels were on the low side. But he said that was to be expected given my condition at the time. But then he asked me about my family history. You see, my father died at 57 from bowel cancer and his father at 52, but we don't really know what of because he refused to see a doctor. The family suspect it was also bowel cancer, though, because of the symptoms he had just before he died. Then on my mother's side of the family, my grandfather is alive but has end-stage pancreatic cancer.
Okay, and how old are you now, Sandra?
I've just turned 50. My GP said not to bother with the self-test kit, but I'm a bit concerned about having a colonoscopy if I'm honest. For one thing, there's the hospital part. Ever since I was a kid, I've been really scared of hospitals. Then, of course, there's the needles. I'm sure I'm not the only one to have a fear of those. It's more the sight of them rather than the feeling. But the biggest thing that frightens the life out of me is the possibility of having a terminal illness.
Well, in terms of the colonoscopy, I can assure you that we give you a very strong sedative to make sure you're completely unaware of the entire procedure. Have you ever experienced any symptoms?
No, I haven't. My GP asked me the same and he suggested some, but I've never had any of them. I had lost quite a bit of weight, but I'd also been on a diet at the time when I saw him. I do have some occasional tenderness in my belly and sometimes I find myself short of breath, kind of puffing. But again, because I've been sick, perhaps it's just from that.
Has it affected your life in any way? I mean, have you noticed a drastic change in your work or hobbies?
Well, I've been a chef for 20 years plus. I work in a fairly hectic environment, so I don't really have time to stop and think about it. The restaurant's always full on. I used to play tennis at the weekend and, yeah, it's definitely held me back from going. Generally, I stay at home. I read a lot more these days. If I have enough energy, I try to go jogging, but I never go very far. Nothing like before. I mean, I used to get to 12 kilometres. I try to stay fit and healthy, though. I'm a big believer in prevention rather than cure. I take a daily multivitamin just to get the full range, and to be honest, that's out of laziness more than anything. It's so easy taking just the one tablet. But I also have vitamin C powder, the kind you need to stir into a glass of water. I'd never take those chewable tablets that you can buy because they're practically useless. Also, each morning I have a teaspoon of fish oil after breakfast.
Well, they're all fine to take. In fact, I'd encourage you to continue all of what you just mentioned. Sorry to bother you, but I need to report an incident. I've had some liquid, maybe blood, splash into my eye. I've already flushed it with normal saline.
Did this just happen now?
A few minutes ago. I was taking the drapes off after the operation and some fluid just flicked up.
Was the drape heavily soiled in blood?
No, it was fairly clean, actually.
Do you know the status of the patient? Any history of blood-borne viruses?
I'm not too sure. His notes are with him in recovery, but I can check.
You'll have to go straight downstairs to occupational health, where they'll advise and evaluate you and possibly take some blood. Then I'll help you fill in a formal risk assessment. Did anyone see the incident?
Yeah, Julie was helping me at the time.
Then we'll also need her to fill out some details.
Mr. Lee just threw a spoon at me.
A spoon? Why?
He hasn't stopped moaning about me all shift, so I told him to stop. That's when he threw the spoon.
Did it hit you?
No, he's harmless, but that's not the point. He just won't let up. He's fine with other staff, but everything I do seems to be wrong. Apparently, I wrapped his bandage too tight, and he even moaned that I didn't close the curtains properly.
Honestly, it does sound like he's singling you out a little. That's hardly fair.
No, it's not, is it?
I know. Let's ask if you can swap patients with me.
Really? I'd be glad to if you don't mind. I'm sure it's just me he's taken against. I don't want to go back into his room ever again.
I'll give him a few minutes, then I'll go in and try to talk to him.
So, as you all know, we had an incident today. Mr. Parks slipped and he's now undergoing further surgery, this time on his hip. So, having come in for a thyroidectomy, he'll be leaving here with a new hip, not to mention the added anxiety and stress to both him and his family. In the worst-case scenario, this could even result in legal action. Now, all this could have been avoided if a minor spillage had been dealt with at once and protocol had been adhered to. I know it's been a very busy day and we're all under pressure, but incidents like this should never occur. I must emphasise, Our policy of immediate action upon any spillage of any liquid or substance is in place for a very good reason, to protect our patients as well as ourselves.
I'd like to go over some possible side effects of your atorvastatin medication. This is all explained in the booklet I'll give you, but I want to make sure I answer any queries you may have before you're discharged. But remember, you should contact your doctor or the ward immediately if you have any concerns.
Okay, thank you.
The less serious side effects are commonly mild muscle pain or nausea, occasionally diarrhea. The more serious include severe muscle pain, confusion or memory loss, fever, fatigue, a change in weight, dark-coloured urine, or sometimes an increase or decrease in urination, increased or loss of appetite or thirst, jaundice and possible clay-coloured stools.
That's a lot to take in.
You won't need to remember them all, but it's important to be aware of any changes. Is there anything you'd like to ask?
No, I think I'm okay.
The next patient is Robbie Fisher in room 8.
I just met his mother as I was coming in.
Yeah, she's understandably very worried. OK, he's a 6-year-old boy, very unwell, admitted with hypoxia and respiratory distress secondary to a left lower lobe pneumonia. He was given a fluid bolus at 6 p.m. and was started on oxygen at 2.5 litres. He's on ceftriaxone. At around 12 a.m. you'll need to check that his vitals are stable and unchanged from now, and oxygen saturation hasn't dropped. Dr. Stone needs to determine if his blood culture is positive, and if his respiratory status worsens, he'll most likely get you to order a mobile chest x-ray to check for an effusion.
Sure.
So, how do you feel the consultation went?
It was okay, but I don't feel I connected with the patient very well. He didn't seem to want to open up and discuss his condition with me.
I'm glad you picked up on that. It's sometimes difficult for even the most experienced doctor to establish a bond with a patient from the outset.
How could I have handled it differently?
A key aspect of our profession is confidentiality between patient and doctor because it gives a foundation upon which they know they can rely. The patient needs to be assured of this, which in turn helps them relax. Asking questions that are then more open-ended builds on that foundation by allowing the patient to communicate in their own way. This shows that you're there to listen and provide support, and this is paramount for securing any doctor-patient relationship. It comes with a lot of practice.
We're talking today with Dr. Rachel Tisnado, a highly respected epidemiologist and expert on yellow fever. Dr. Tisnado, firstly, what is yellow fever, and what triggered your deep interest in this disease?
Simply put, yellow fever is a viral disease transmitted most commonly to humans, and also monkeys, by infected mosquitoes in parts of Central and South America, and also Africa. It takes about 3 to 6 days for the illness to begin after the initial mosquito bite. But what's so interesting to me is that up to a week after symptoms appear, an infected person can actually retransmit the infection to the mosquitoes who bite them, forming a seemingly endless cycle. That was the point that grabbed me and pulled me in, so to speak. And then what kept me involved was the fact that my son, who was 22 at the time, then contracted this disease just after my research had begun. The distressing part for me, not only as a doctor but a mother, was that this could have been avoided if only he'd taken the recommended precautions. A simple vaccine.
If the vaccine for yellow fever is available, why are people avoiding it?
It's highly recommended to all travelers who plan to visit particular regions, and the large majority follow this advice. However, individual beliefs and personal choice greatly impact this, which include concerns over serious side effects, which I should point out are rare. In this day and age, information on vaccination is now readily available to all through the internet and social media, which sadly is where a lot of people are gathering their so-called facts, which then lead to their decision-making. With all good information, there's also misinformation, and this is the dangerous part because that misinformation is often included in the formation of people's beliefs. Instead of communicating with medical professionals, which is vital, the factual data is sometimes overlooked, and that's when people run the risk of potential infection.
Now, I know your son fortunately survived. Can you tell us more about his case?
Unfortunately, he was in the group that overlooked the available data and my advice. But he was only a young adult at the time, so I can hardly blame him for this. He was lucky. Yellow fever is characterized by 2 stages. In the first, symptoms such as headache, fever, and muscle pain are common. About 15 to 25% then progress to the second stage, known as the toxic stage. And if he'd progressed to that level, I may no longer have a son. Of those who do enter the second stage, half die within 10 to 14 days after onset of the illness.
Brazil has often been labeled a high risk for contracting yellow fever. Can you give any statistics?
In 2017, there were 10 travel-related cases of yellow fever from tourists who'd visited Brazil. I should say that none of the 10 reported cases had received a vaccination, and I firmly believe this outweighs all other causes for contracting the disease. Of the 10, half were from Argentina and Chile. The other 5 were from parts of Europe. This suggests to me that going unvaccinated has little to do with mass education, government spending, or the like, although I'm still a big supporter of such methods. I believe it comes back to a combination of individual choice, fear campaigns, and misinformation. But the bottom line is, again, vaccination. And, to a lesser extent, a belief in the "it won't ever happen to me" scenario.
Right. For those who don't have the vaccination, are there other steps to take to prevent contracting yellow fever?
Of course. And doing so saves countless lives. There are a number of prevention methods that all people should take, even those who've had the vaccination. Avoiding mosquitoes is the most obvious of these. Those that transmit yellow fever are actually most active during the day. Wearing repellent containing DEET and light-colored, long-sleeved clothes is a must. Leave the perfumes and colognes at home, as they can attract mosquitoes, as well as using screens to prevent them from entering your accommodation. Even at night, a mosquito net is recommended. These are all good safeguards, and I'm certainly not entirely dismissing them, but to me, they are still a gamble. Vaccination is hands down the superior method, which, by the way, lasts for a lifetime.
So, what needs to be done to get the correct information across?
Education always has and always will be our most valuable tool, but people find the topic and language of vaccination confusing. Of course, more needs to be done to get the message across to all people, and a positive way to achieve this is to make specialist knowledge freely available worldwide in a dedicated website with factual, evidence-based information in a language everyone can understand.
Hi everyone, my name's Jennifer Seaver. I'm a clinical nurse educator and I'm here today to talk about something very familiar to us all. It's a routine that can potentially save numerous lives and one that we've all been taught since we were toddlers: hand hygiene. This is described by many healthcare workers as possibly the single most important tool in preventing the development of healthcare-associated infections between patients. Infections such as Staphylococcus aureus, Clostridium difficile, MRSA, and gram-negative bacteria. Most hospitals have strict policies and guidelines that we must all abide by. So if it's so important, why do we continue to see such an underutilisation of such a basic practice? Why don't we follow the procedures that should already be ingrained? This, unfortunately, has proven difficult to determine. Let's first put things into perspective with new data from the Centers for Disease Control and Prevention in the USA, which found that 1 in 25 patients acquires a healthcare-associated infection during their hospital care. Now, for whatever reason, This figure doesn't tend to set off any real alarm bells in people, but that adds up to about 700,000 infections a year. A little more alarming. The clincher, however, is of those, 75,000 patients die from their infections. That's an incredible number, and one that should shock anyone hearing it, because it's a number that quite often reflects human neglect and forgetfulness. One may even suggest at times laziness. Stopping the spread of infection by way of hand hygiene is hardly a new concept. Its importance was first brought to life in the mid-19th century when it was found that physicians who washed their hands before delivering babies prevented deaths in postpartum women. Such an idea was initially ridiculed, as most new theories are. But even now, after centuries of knowledge, it seems to me we're still, in many ways, ridiculing it by simply overlooking this basic practice. In stopping the spread of infection, even the most advanced healthcare is of little use if the basic principles of hand hygiene are neglected. We have valuable technologies and intricate tools at our disposal to prevent hospital-acquired infections, and yet such advancements can so easily be made redundant if healthcare workers don't toe the line and simply neglect to wash their hands. That doesn't sound like genuine advancement to me. One of the most valuable things about hand hygiene is that it works for so many different types of organisms, and you get a lot of bang for the buck, so to speak. Such great protection from so many nasty things by such a simple and inexpensive action that any person can do with ease. The issue is that you have to practice it at a high level of compliance for it to work. Within a hospital setting, there are so many opportunities for hand hygiene, and it's difficult to get a level of compliance where we're able to make changes to infection rates. What we need to do to combat this is to turn hand washing into what many people already suppose it is, an instinctive ritual. So how do we monitor people in a healthcare setting without hovering and interfering? The gold standard in monitoring hand hygiene compliance is direct observation. But the reliability of this method to measure true, actual compliance is questionable. This is because it increases dramatically when observers, who are usually well known to the staff, are circulating in the unit. The rates then decline almost immediately once they've gone. Furthermore, being a known staff member also influences this. I'll give you an example. In one study, we hired a student for hand hygiene observation in the same unit as a well-known staff member. We found that the staff member observed close to 70% compliance and the student observed close to 30%. The bottom line is that there's a big discrepancy there. The main problem associated with a lack of hand hygiene compliance, I believe, is that humans are not, in fact, naturally hardwired to perform hand hygiene in the absence of sensing a substance on their hands. If compared with the use of seatbelts, for example, most people don't even think about putting the seatbelt on when they get into a car. They do it on a subconscious level, and they're usually not even aware they put it on. That's where we need to be with hand hygiene, hardwired so that we do it without even thinking about it. When a behaviour is hardwired like that, you can always sense when you didn't do it because you start to feel uncomfortable. It's a long process, however, to get to that end point.